All right, we can go ahead and get started. Welcome, everyone. We were all just saying, sorry, to start off, my name is Zaria. We'll do introductions first. My name is Zaria. I'm one of the co-presidents of Cal State LA's SNA, Student Nurses Association. I am currently a senior nursing student, so I'm graduating this spring in May. So I'm super excited.
Hey guys, my name is Mackenzie Hernandez, and I am representing Cal State Long Beach is nursing program. I am the pre-nursing like student director for our CNSA, California Nursing Student Association, and I am in my last year as well, and I'll be graduating this May too.
Hello, everyone. My name is Krista. I will be representing Cal State Fullerton. I am currently Cal State Fullerton's Nursing Student Association president, and I will be graduating this upcoming May as a senior. And I'm super excited to be co-hosting this info session with Cal State LA and Cal State Long Beach.
Hi everyone, my name is Catherine Guillen. I'm also representing Cal State Fullerton. I am a second year nursing student. I transferred fall of 2023, and I'm also a part of our Nursing Student Association. I'm a BLS assistant.
Perfect. Thank you guys all for joining us today. We're super excited. We were just saying before the meeting started that a lot of us didn't have the resources that we're able to provide you guys, like from our SNAs, like just regarding application processes, how to get in, the requirements and everything. So thank you guys for joining, and we hope that this info session is super informative for you guys. So we'll go ahead and get started.
Oh, sorry, what happened? Okay, can you guys see my screen? Can't see you guys, so
Yes, we can see it.
okay. Okay. So we're going to start off with Cal State Long Beach. For Cal State Long Beach, the programs that we offered is BSN undergraduate, the RN to BSN, and our DNP. So right now we're just going to be solely talking about our BSN undergraduate. For the 2023 to 2024 year, we have 100% NCLEX first time pass rate. So we're just going to go over the requirements and kind of like the application process if you are interested in applying to Cal State Long Beach. So in your application, you're just going to need the Cal State Long Beach supplemental application, the Cal State Apply application, and then there's a School of Nursing BSN application that you would have to fill out as well, and then the Casper testing, which is new. So yeah, so we kind of have like a new different way of how we're going to be admitting people. So we're going to make sure we highlight those differences. So all applicants are evaluated based on a GPA and their Casper score. So for their prereq classes that you'll need, you're going to need anatomy, physiology, a chem lecture and lab, and then a micro. So make sure to look at assist.org, especially if you guys are transferring, to make sure that your classes are equivalent to the Cal State Long Beach's prerequisite requirements. So Casper is a situational judgment test that measures different personal and professional skills that we believe that is important for successful students and graduates of our program. So this complements other tools that are used in the application and review and evaluation. The purpose of Casper as well is to enhance the fairness and objectivity in the selection process. So if you guys want to see any more information regarding how to sign up, then look at this link right here. And then the Casper test is going to be reviewed by professionals that are trained to reduce like implicit bias, and it makes sure it evaluates traits like empathy, problem solving, resilience, and self-awareness. Just to know, you can't study for the Casper, but you can prepare by knowing what to expect. And also just be aware of those companies that can scam students for offering review courses. Because again, this is a situational judgment test, so there's not really a way to study for this. You can only take this test once per admission period. And then students are going to be receiving a general quartile ranking score based on the applicant pool, and the School of Nursing will also receive a more specific result. Yeah. So for the gen ed classes that are required, you must have like a C or better, and then a 3.0 or better right here. So all of this information I am pulling off of our School of Nursing website. So if you type on Google CSULB School of Nursing, then it gives a more detailed summary what we expect as well. So here I'm just summarizing. You need a minimum GPA of 3.25. You must take stats, oral communication, which is kind of like a speech class, a written communication or college composition, and then a critical thinking class as well. So these applicants, they're going to be, there's going to be a score that you'll be assigned or you'll be calculated on. And based on the highest ranking scores in the applicant pool, they'll be offered an invitation to a on-campus interview that they must complete. So here, something different is that the finalists will also be asked to submit a written statement describing community engagement and other life experiences. So, which is really unique because we didn't used to take account if you have any kind of like experience like as being a CNA or like a caretaker, or we also count it like if you're caring for like your grandma, your grandpa, if you have relatives at home that need a lot of medical supervision, like we also count those. So we're going to be start incorporating experience. So once you're admitted to the program, this is kind of how our schedule is going to look like. So we have a total of 5 semesters. So you can choose, we have a trimester route or a semester route. So essentially, the trimester route, you're taking summer classes, so it's a much faster pace. For semester, you don't get you get a summer break, so you don't get you're not taking any summer classes, but you do finish at a later time, if that makes sense. So, for example, if you are being admitted in fall 2025, right here, for trimester, this is kind of like how your first, second, third, fourth, and fifth will look like. So comparing it to the semester, while they take no summer classes, they won't start, as you can see, like the difference here. In the third, you'll have a summer class. Your third semester will be a summer class. For if you're taking the semester route, your third semester will be in the fall. So here is a summary of and this will be the spring admission. We do admissions for fall and spring. So your first semester here at Cal State Long Beach Nursing Program, you're going to be taking fundamentals, pharmacology, patho, and then the fundamental clinicals. Second semester, we're doing a med-surg health assessment. We have a health assessment lab, and then your med-surg clinicals. For the third, it'll be ICU research psych, ICU clinicals, and psych clinicals. For fourth, it'll be labor and delivery, pediatrics, leadership, and then the labor and delivery clinicals and the pediatric clinicals. Community health, for fifth, it'll be a community health, and then the NCLEX preparation, and then your preceptor clinicals, and then the community health clinicals. So clinicals for trimester students, we only stay at one hospital our entire nursing program. So we are at Long Beach Memorial Medical Center and Miller's Children's Hospital. So the pros about this is that we really get to know the nurses, the way the unit, like the units and stuff, and then we get to form connections with hiring managers as well. So a lot of our graduates do end up working at Long Beach Memorial. Aside for psych clinicals, we can be placed at UCI, Anaheim Community, La Casa, or VA Long Beach. For these semester students, the pro about this is that they get to rotate through different hospitals. So it's not like the trimester students where they only stay at one hospital. We get to go to the VA, Hoag, St. Mary's, etc. All of these. Some of the specialty days that we provide in our clinicals, which is amazing. So we have one day in our clinicals dedicated to a specialty unit. So for example, we'll be following a wound care nurse. We get to follow Stevie, the cardiovascular OR for one day, GI lab, ER, NICU and PICU, cath lab, PACU, and then we also get to be team leader, which is kind of like a the charge nurse. For Cal State Long Beach, we have a lot of student support resources. We really, I love our nursing program because we're so supportive of each other. We have so many amazing professors, clinical instructors, and also just an amazing cohort too. So we offer skills lab, which is kind of, we get to practice how to put IVs, if you want to practice how to put the nasogastric tube, if you want to practice how to do like a health assessment on a patient. We have a skills lab that offers a supervision by professor and also practices with updated hospital equipment. We also have CNSA, which is a club. It offers leadership positions for nursing students. We have a mentor-mentee program where we get to, in your first semester at Cal State Long Beach, you can choose to be paired with a upperclassman nursing student, and then they guide you with how to study for a class, how the teachers are, how your clinicals are, etc. And we also do volunteer opportunities as well. And we connect with other nursing clubs too, like Cal State LA and Cal State Fullerton. We have tutoring services for our School of Nursing. The tutors are previous nursing students, which is amazing because they know how to study for these classes. And we also have a social worker for nursing students. Nursing school is really hard, and a lot of us deal with a lot of stress and anxiety just because we're all type A students. So we have kind of like a social worker with us, helping us deal with our emotions, and it's really helpful. So again, my name is Mackenzie Hernandez. I am the CNSA pre-nursing director at Cal State Long Beach. The best information, if you want to reach out to us, ask any more questions, is to email me, or you can also send a DM to our Instagram too. So we're going to be having we'll talk about it more later, but we're going to have the opportunity where you guys can come to Cal State Long Beach and look at our nursing school, and we'll be updating with more information on our Instagram. So make sure to give us a follow. Thank you guys.
Okay, thank you, Mackenzie, for that amazing presentation. Hello, everyone. Again, my name is Krista. I am the president of NSA, and I'll be talking about Cal State Fullerton's nursing program. So at Cal State Fullerton, we offer our bachelor's program, our master's program, and a doctor's in nursing practice program. Again, we're going to mainly focus on the upper division transfer program. So as an upper division transfer, you will be joining the traditional cohort or the traditional BSN cohort. If you were accepted to our program in from high school, we do have a 4-year program as well as a 5-year program. As an upper division transfer, you will be partaking in our program for 3 years. Just going into a little bit in depth about our other programs, we also have a master's program in leadership, in women's health, and in school nursing as well. So after you complete your bachelor's program, if you want to go back to our school and participate in our and complete a master's degree, these are some of the other concentrations and specialties that you guys can look into. We also have an amazing DNP program as well. It's a 3-year program, and we mainly specialize in nursing anesthesia. And there's also a postmaster DNP, which you can enroll in once you complete a master's program. We're also planning to have a family nurse practitioner program as well within our School of Nursing. So that's just some things that we are looking forward to in the future. Okay.
All right. Hi, everyone. Again, my name is Catherine. I'm a second year nursing student at Cal State Fullerton, and I did transfer fall of 2023. I know how stressful transferring can be, especially when you're looking at nursing programs. So my biggest piece of advice is to organize yourselves, make a list of all the different requirements for all the schools because they're all very, very different. So when you're transferring into Cal State Fullerton's program, you'll be transferring into the upper division transfer pathway. And you'll be earning your bachelor's in science of nursing or your BSN. And this pathway is 3 years long and it starts at every fall semester. So if you're applying right now, you'll be applying for fall of 2025. Um, so something that's a little bit different than from when I applied to transfer into the program, starting last fall, there will be no more, we can't accept any in-progress prereq courses, meaning if you're applying while you're taking, let's say, anatomy and physiology, you can't apply if you're taking that class, if that class is in progress. So you have to make sure that all your prereq classes are completed before you apply to the program. So that's what the second bullet point is saying. So make sure all your prereq classes, if you're applying for fall of 2025, all those prereqs have to be completed by the end of fall of 2024, so last fall. Um, Also, applicants must have at least a 3.25 cumulative GPA in all of their transfer credits. And something that's super important to note, in any science prereq course, you have to get a B minus or higher. And then if you're taking a non-science prereq course, you have to earn at least a C. So for example, if you're taking microbiology or anatomy and physio, those classes you have to have at least a B minus. But if you're taking any other prereq course, like English or your communications class, then those ones you can earn a C or higher. And then a quick overview of just the steps to apply into our program. First, you want to submit the CSUF application through Cal State Apply, and that deadline was November 30th. So you would be applying to, again, to the upper division transfer BSN pathway. And then, or step two, you want to make sure you send one set of official transcripts from every college level institution to the CSUF Office of Admissions. So, what that means is that, for example, I did all my prereqs at a community college in Northern California, but I also took some classes at a different CC. So I had to submit to both of those transcripts to the Office of Admission. So if you took prereq courses at different community colleges, you want to make sure to submit all of those transcripts. And also, if you took any AP or IB class, make sure that you send those score reports as well. And then those official transcripts are due at the end of this month, January 31st. And you can either mail it or send it in electronically, but we do prefer the electronic transcripts. And then lastly, your applications will be reviewed for admission, and then the top candidates will be invited to interview, and you'll receive an email if you're invited to interview. The interview is virtual, so it's not in person, and it's not over Zoom. It's a different virtual site. I forget the name of it, but pretty much how it works, they give you a question and they give you about 20 seconds to prepare your answer. And then I believe you get about a minute and a half or 2 minutes to reply to the answer or reply to the question, sorry. So it could be any interview question like, why do you want to be a nurse? Or they do get a little bit trickier. For example, I think it was something like, what would you do if you're asked to do something out of your scope of practice? So questions like that. And then they'll review the videos and then they'll let you know if you've been accepted into the program. And then there's also a wait list for transfer students as well.
Hi, everyone. So, for those that just joined this Zoom, we're leaving questions for the end of the presentation after all schools have finished their slides. So, save questions for the end, please. So, moving forward with the schedule overview, Cal State Fullerton goes by a semester system. So, as an upper division transfer, you will be having your summers, which is great. For your first semester, you will be taking health assessment, lecture, and lab as well as concepts of professional nursing, which is a writing class, as well as integrated pathophysiology and pharmacology. It's a combination class. Your following semester, you'll be taking a research class, which is Nurse 310. It's evidence-based practice in nursing, as well as a cultural diversity in health and illness. Yeah, this diversity class does not last the entire 16-week semester. It will only be, I believe it's 10 to 12 weeks. Um, and you'll be also taking foundations, lecture, and lab as well within the semester. Um, for fall, you'll be taking mental health, lecture, and lab, clinical, and also med-surg, lecture and lab as well. For your spring, you'll be taking nursing 406, which is reproductive health nursing lecture and lab. This is basically L&D as well as nurse 407, which is your pediatrics rotation. Um, for this semester, it's only around 10 weeks. So you will be finishing the semester off early. Um, and lastly, for fall, you'll be moving into leadership management, which is lecture and lab as well. And this course only lasts for 10 weeks. And also, you'll be taking your critical care course as well. And for your last semester, it will be population health lecture and lab and your nursing capstone, which is basically your preceptorship. And normally, for your preceptorship, whatever clinical site that you've had in fall for your critical care rotation, you will also have for your spring preceptorship as well. Moving on to clinicals at Cal State Fullerton. So the hospital sites are primarily in Orange County as well as in LA County. We do fill out a clinical site placement application prior to the semester starting, and you can fill in your preferences and any comments in regards to what you may prefer for your clinical rotation, but obviously we may not be able to accommodate everyone. A lot of students at Cal State Fullerton are commuter students that commute from Los Angeles or Riverside County. So our clinical placement coordinator tries to accommodate to them as best as we can. But a lot of the times, students do have to travel to Orange County for these different clinical sites. We do have hospital sites with Kaiser. We have Kaiser Anaheim, Kaiser Downey, and Kaiser Irvine. Anaheim Regional Medical Center. We also have placements with UCI Placentia Linda and UCI Los Alamitos, as well as UCI Medical Center in Orange. We also have other placements that are outside of Orange County, such as Corona Regional Medical Center. We also have Orange Coast Memorial and Pomona Valley Regional, Saddleback Memorial, Mission Hospital Providence, St. Joseph Hospital in Fullerton, and St. Joseph Hospital in Orange, as well as St. Jude Medical Center in Fullerton. We also have CHLA, Chalk, VA Long Beach, and PIH Health Whittier Hospital. So all these schools are in different counties, mainly trying to accommodate for our commuter students. And if you're placed at CHLA or Chalk for pediatrics, you will have a night shift clinical. So clinical courses can be any day of the week, day or night shift or evening shift, and they can be within a 50-mile radius of our CSUF campus. It really does depend. We do try to accommodate for all our students' location and try to make it convenient, but you may have a weekend clinical and a night shift clinical as an option as well. For specialties, these are just some specialties that our clinical sites mainly go into. We have med-surg, tele, oncology, emergency room, ICU, L&D. If you're in a pediatrics rotation, you will have the opportunity to possibly go into the PICU or NICU. Our psychiatric mental health um, specialty as well, public health. During your med surg or critical care rotation, you may have the opportunity to go to cath lab, GI lab, and critical care. We do have a leadership day where our students follow a patient in pre-op. They go into the operating room and then they have a chance to shadow a nurse in the PACU as well during your critical care rotation, which is a very insightful opportunity. But yeah. So some student support resources, we do have a lot of clubs and organizations that prioritize in obviously supporting our different nursing students. We do have NSA, and within NSA we have a big little program. It's a bit of like an informal mentorship program, but basically we have our mentees fill out an application and we, based on their interests and maybe in their field of nursing as well as like their personality, we do assign them to a mentor. And a lot of these mentors are upperclassmen that have probably taken the same courses that these lower classmen have taken in the past. And we also have a health and human development peer mentoring program. It's actually a class that nursing students can partake in, but it's also a bit more of a formal mentorship program as well. And if you're a nursing student that wants to earn more class credits, you can join the specific class as well. We also have a nursing peer tutoring club on our campus where it is um, we have a website and there's online Zoom sessions for specific nursing classes, and a student tutor um, has the ability to lead these classes and um, lead these certain classes, and they're basically drop-in Zoom sessions. And we also have our Sigma Theta Tau International Honor Society, which you can be invited to if you have a certain grade point average. The School of Nursing also offers a lot of amazing resources as well. We have our nursing librarian. So if you're writing any research um, papers or articles, the nursing librarian can help you find specific articles for your research. We also have an academic writing coach and a career coach that can help with resume writing and cover letter writing. And we also have a nursing coach as well, which is similar to the social worker that Cal State Long Beach has. We understand that nursing school is very stressful, so we do have a nursing coach that can help facilitate the stress and uh, that nursing school may uh, provide for you. We also have a lot of DAI resources. We have a Latinx student group, a Black nurses student group, and a men in nursing student group. And we also have other specific Cal State Fullerton diversity initiatives and resource centers as well.
And then Cal State Fullerton also offers a certificate program for Spanish course, and it's for health and human services professions. So I took it's a 2 semester program. So I took my first part of it last semester, and I'm going to take the second part this semester. But pretty much this program is designed to help with oral proficiency in healthcare fields with Spanish. And what's really nice about this program is that it goes through different pronunciation with different medical terms in Spanish. And it's also an online synchronous format. So we don't meet in person, we meet online on Zoom, and it's once a week. And then there is a prerequisite course for this program, or if you're bilingual, you just have to show proficiency in Spanish, and then you can also be a part of this program. But it's really nice because, for example, I'm bilingual, but I don't really know how to say certain things in Spanish when it comes to medical terminology. So this class is really nice because it helps you work on that communication. Using medical terminology when you're speaking to a patient. So this is a really cool resource that we have also at Cal State Fullerton. And yeah. And then here's our contact information. Our NSA website is on the left, and then our Instagram is on the right. Feel free to contact us with any extra questions that you guys have if we don't get to them at the end of this presentation. And then we also have a simulation lab tour coming soon. I believe it's at the end of this month, but make sure to follow our Instagram for updates on that as well. Thank you guys.
All right. Introduction again. My name is Zaria. I'm one of the co-presidents at Cal CLA's SNA program. So a little bit about our program. Today I'll be focusing on the traditional route, but I just want to introduce to you guys just all what our school offers. So for undergraduate BSN programs, we offer a traditional program. Every traditional program is 3 years. We also have an accelerated BSN program, so you will basically be awarded another bachelor's degree. Those who are able to apply to this one, you have a bachelor's degree in another discipline. Say, for instance, if you were a psychology major or biology major, and then later in life you decide that you want to go into nursing, this is the route that you will go into. It's 15 months. We also have an ADN to a BSN route. So those who are coming from a community college and looking to transfer over, we have one specific for you guys, and that's 2 years. If you guys are looking to further your career later down the line, we also offer a master's route. It's 2 years, and we have different disciplines: education, family nurse practitioner. We have adult, primary, and acute care. So if you're into critical care like ICU or ER, you can get your nurse practitioner's discipline in that. And then also we have a family psychiatric mental health nurse practitioner program. Our DNP program, your doctorate, that's actually a new program that we just opened this year. So our school is super excited to finally launch that, and we're expecting great things. Just a couple of these pictures on the side. This is really how involved we are with our SNA. We offer a lot to our students. We hold a lot of simulation classes. This picture down here is actually my cohort. So expect for the traditional cohorts to be about 65 to 70 students in one cohort. All right, so some of the requirements, again, I'm going to be mainly talking about the traditional route. So the traditional route is 3 years and it's a semester program. So it'll be 6 semesters. Like Cal State Fullerton, we get winters and we get summers off as well. So that's really, really good, especially with nursing school. We're super busy. A lot of us work. So we have a little bit of a break. After you complete this program, when you're about to graduate your 6th semester, you'll be awarded your Bachelor's of Science in Nursing. And with that degree, you'll be able to sit for the board exam, which is also known as the NCLEX. One thing that I do want to emphasize with our school, Cal State LA, we only admit students once a year. So we don't, I know Cal State Long Beach was different. They did spring and they did fall semester. We only offer admission once a year, every fall semester. And then applicants are only able to apply once. So if you applied once and unfortunately, if you get denied, you are not able to apply again. You can apply to another discipline. So like if you want to go back in a couple years for the accelerated route, but you can't apply twice to the traditional route. So going into more of the requirements, so the applications, if you guys are transfer students coming in, you have to complete that CSU apply application. So the one that's open from October to November 30th. After you get accepted there, then the next application, it's a specific one for our School of Nursing. A lot of other nursing schools also use it as well, so it's good to get familiar with it. It's called Nursing Cast, and this is open October until every January. And this is the same time frame every year for it. So the requirements to actually be eligible to apply to our program, your GPA. One thing I always emphasize to pre-nursing students, you will see on our website, everything says minimum, 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 or recommended. Ignore those words. You want to try to achieve for the highest that you can. So if it says minimum, try to achieve for this competitive or more. Same thing if it says strongly recommended, just think of that like as if it's mandatory because you're applying against like probably over 1,000 applicants, and you want to be able to do the most that you can do to make your application stand out. So when we're talking about GPA, in order to be eligible to apply to our program, you need at least an overall of a 3.25 GPA. But honestly, I don't know anyone who's gotten accepted within the last couple years who hasn't had anything over a 3.6. So just make sure you're competitive with that. With our prerequisites, it's required that you have anatomy, physiology, chemistry, micro statistics, and then all of like the A category. So the communication, the critical thinking. So it's the A1, A2, A3. But you guys see the ones that are highlighted in red right here. This is required when you guys are applying to the program. The rest of them, you need them in order to continue to get admitted to the program. But at the time that you're applying, they can be in progress. So just keep that in mind. Um, when we're talking about grades for these particular prerequisite courses, we only take B's and higher. So if you get a B minus on one of your courses, unfortunately, you're not able to apply to our program because you're no longer eligible. And it also has to be on your first attempt. And trust me, they know because you have to send over all of your transcripts from every single school that you've gone to. So if they see, oh, I was at Cal State Long Beach first and I got a B minus, I retook it at LBCC and I got an A, you will no longer be eligible because you needed that B on that first attempt. So keep that in mind too. There's no course expiration that actually just changed a couple years ago. So that's amazing. If you took anatomy 5 years ago, you're still able to use that to apply to our school. Please, especially if you're not coming from Cal State LA as a pre-nursing student, please utilize the resource assist.org. You guys are able to kind of basically match. So if you took one anatomy class at LBCC or any other community college, you're able to put in your course and then the course that Cal State LA is looking for and see if they're compatible. And then keep in mind that all of these courses, even so, the ones in red are the ones that you guys need to have before you apply. But every other course, keep in mind that those need to be completed before the spring semester that you start. So you'll start in the fall. These classes need to be done by the spring. And also, I'm going to keep on emphasizing the B on the first attempt. I actually know a couple people who were offered admission to our program, and unfortunately, they got below a B on some of their prerequisite courses, and their offer got withdrawn. So they're super, super serious about you guys having a B in these courses. Another part of our requirement, we have a TEAS examination. So TEAS, I like to kind of describe it as if like it's a mini SAT. So it's testing you in four different categories: reading, math, science, and English. You guys can buy resources off of Amazon. I personally use the Mometrics book. It's the black and yellow book on Amazon. But again, 70%, that's what's required in each of the subcategories. So you have to have a 70% in each one of these four. But competitive is at least an 80%. I personally don't know anyone who's got accepted who has had anything lower than 80%. So just keep on trying. And the good thing about our school too, there's no requirement how many times you can take it. So you can take it 20 times and they will still accept you. Um, Lastly, volunteer and work experience. You will see that it says that is strongly recommended, but not required. But we encourage you guys to have experience in anything, and it's good up until the last 2 years. So some of the main ones, if you're an EMT, if you're a CNA, a med tech, a caregiver, a care assistant, medical assistant, any one of those disciplines, as long as you're having direct patient care experience with patients, interacting with patients, they will accept it. So that's for work experience. If you're not able to get work experience, I would recommend you guys getting volunteer experience. One of the ones that I got experience in that works super well with my schedule as a pre-nursing student, I was a blood donor ambassador for American Red Cross. They work with your schedule, it's super easy to sign up and get accepted. So please write that down if you guys are looking for volunteer hours, and a lot of nursing schools will take that. So definitely worth a look. All right, our schedule overview. I'm not going to go too much into this. You guys will focus on this and worry about this once you're admitted to the program. But I'll give you guys a little introduction. I think the beauty of it is, so the way that our nursing program is set up, it's in cohorts. So it's like class of 2025, it's cohort 2025. So all of us are taking all of our lectures together. All of us are taking our clinicals together at the same time. So the way that is structured for fall semester, we take our introduction courses, fundamentals, and health assessment. We also have our clinicals. And so this is all broken down into 6 different semesters, different disciplines and different specialties you guys will be able to explore then. Every semester, you guys will be having a clinical that will match the lecture component of the course. So it's good because we get to explore med surg, we get to explore different critical cares like ICU, ER, psychiatric, working with children and pediatrics, PICU, labor and delivery. I know everyone loves being super involved with that, and our clinical sites allow us to be super, super hands-on. So it's definitely a great experience with Cal State LA's. Next, clinicals. So these are just a few of our hospital sites that I was able to come up with from the top of my head. We are affiliated with a lot of hospitals. So all of our hospital sites are going to be within the LA County. Like I think Krista had said, like Cal State Fullerton, our school is also a commuter school. So our placement team really tries to work with the students. And where they live, their mileage and everything. For example, me, I live in like the Long Beach area. So most of my clinicals have actually been in Kaiser Downey because it's about 15 minutes from me. Like they want to place me at Cedar Sinai, which is deep, deep LA. So they do a very, very great job with trying to accommodate your mileage and how far you live compared to your clinical sites. Another thing I didn't mention with our lecture days, the way that it's set up at our school, you have one full day of lecture and then you have one full day of clinical at your hospital. So you can kind of expect throughout the week is 2 days you need to commit to nursing and for school, and everything else is kind of like independent study. You're at home doing your homework, your assignments, case studies, care plans, whatever it may be. So it's super, super flexible, especially for a lot of us who work too, allows us to have that flexibility. So just to name a few of our hospital sites, we're affiliated with a couple of Kaisers, Cedar Sinai for our pediatric rotations. We have Children's Hospital. We're affiliated with a lot of the UCLA locations, USC Keck, Torrance Memorial, Huntington, White Memorial, PAH Whittier, Valley Presbyterian, and so, so many more. And our different specialties, I know I mentioned them a little bit before, but med-surg, tele, intensive care unit, emergency labor and delivery, pediatrics, psychiatric, mental health, public health, and then our final capstone, which is our preceptorship. So your last semester, you will basically pick your hospital site and your specialty that you would like. And you will complete full 12-hour shifts shadowing that nurse in your discipline. And if you play your cards right, ideally, a lot of the students who do their preceptorship there, typically they find their first employment at their hospital that they precept at. So nursing school, I always like to say it's your opportunity to make those connections, to start your networking. So yeah, especially with a lot of our hospital sites, it's really top of the notch hospitals within the LA County. So make your resources and you guys should be good and set up for success for applying to hospitals. So a couple of our student support and our professional development, Student Nurses Association, we are very, very involved with not only pre-nursing students, but just with all the different cohorts. We offer a lot, our mentorship program, we offer a lot of professional development events and workshops and everything. We have our simulation lab. We're actually working on getting it accredited. We have a lot of high fidelity mannequins and mandatory simulation days. So our school really focuses on developing our critical thinking and allowing us to be comfortable in the simulation environment before we go out to the hospitals and actually being hands-on with the patients. We have an amazing director who is really personable with the students and everything. So we have really been utilizing our simulation lab. Like I said before, we have a lot of nursing workshops and seminars. We have a lot of certification courses. We offer basic life support. We offer advanced life support, pediatric life support. We also offer like Stop the Bleed certifications, Narcan training, just a whole bunch of certification courses for our members to benefit from, to add to your resumes to increase your chances of getting into any new grad program that you want to apply to. We have a lot of leadership opportunities within different organizations, class cohorts, committees. We also have nursing tutoring. It's within the Center of Academic Success to allow you to get tutored from other nursing students. We have Sigma, which is a group that you have to get invited to if you have over a 3.5 GPA, another great resume boost. We have different internships that allow students to get paid. So we have one that we're associated with Kaiser, and also Altamed if you guys are interested in community health and helping the underpaid communities, flu shots and clinics and all of that. We also have conferences and nursing fellowships as well. We're actually taking a group of 8 students to Seattle in April, and that's due to our school just being able to provide those funds and support these students. So a lot of great opportunities for nursing students at Cal State LA. All right, and this is our last slide. Well, for Cal State LA, here is the Paxton website. I have it as QR code, so please get out your phones and scan these. The one on the left, the website allows you to have all of the information for every single program that we have. So I mainly focus on the traditional today. A lot of them are the same, meaning like the roadmaps and what clinical sites and specialties you guys will get experience with, but every single discipline is listed there and also our Instagram account too. So if you guys have any questions, please DM us on Instagram, or you can also email us at calstatelasna@gmail.com.
Thank you guys so much for joining us today. Again, like what we said, we're gonna have an open house event for each school, and that'll be announced on our Instagram. So please follow us for updates. Reminders, this meeting will be recorded and posted on YouTube on Cal State Fullerton's YouTube page. So you can find it by searching Nursing Student Association at CSUF.
Thank you guys for coming. We are going to allow you guys to ask your questions. We are going to be monitoring the chat portion, so please just drop all of your questions in the chat and we will answer them. Please make it specific for what school you have questions for as well. Okay, there are a couple in the chat. Let's
Yeah, there's a
see.
few.
Okay, any information on ADN to BSN collaborative programs for those of us currently in nursing school at community college? Yeah, so today I know for all 3 of our schools, we really focus on the traditional route for those who are looking to transfer in as a pre-nursing student. But if you want more information specifically about your route coming from community college, the ADN to BSN route, look at our websites because it has every single discipline strictly there as well. But the process will be very, very similar. I know, at least for CalCLA, ours, it's a different type of application. Like it puts you like in a different priority too. So look at our websites and it'll give you a little bit more information about that. Um,
Um,
sorry, go ahead.
Sorry. A question that we have for Cal State Fullerton specifically is, does Cal State Fullerton accept students from LA County? Yes, we do accept students from LA County. We accept a lot of students from San Diego County. I'm from Orange County. And Catherine, you're from NorCal.
Yeah.
So we really do accept students from different counties as well. So. I hope that answers your question. I received a direct message for Cal State Fullerton School of Nursing is Fundamentals of Chemistry and Acceptable Chemistry Prerequisite course.
So that's one of the things you want to look at in assist.org, which both Mackenzie and Zaria mentioned. If you go to assist.org, you can put in the chemistry class that you took and then compare it to the one that's required by all 3 of our schools, and you can see if it applies or not.
I will say because I know I went through the whole process too of me trying to transfer to a whole bunch of other schools like 3 years ago. Um, my school, I was a pre-nursing student at Cal State LA, and I took a fundamental of chemistry course. And every single school I applied to Cal State Fullerton, I applied to Cal State Long Beach, any other Cal State school, all of them said that they wouldn't accept fundamentals of chemistry. It needed to be like an integrated course. So combination of general chem, I think it was biochem. It was like three different chems combined it together. So yeah, like Catherine said, look at assist.org, but I would also recommend too just emailing whoever's name is like on that website because I was emailing literally every single contact from every single school, just trying to make sure that whatever school I was applying to took my courses. And in my case, they didn't. So I took the integrated course at a local community college just to be eligible to apply. But yeah, definitely look into that before you're spending hundreds of dollars of trying to apply to different schools. Let's see. Another question.
Um,
Sorry, go ahead.
okay. For transfer students, would we apply as a pre-nursing major when applying to the CSU apply or as a nursing major?
It would be nursing major. So no matter what school you're applying to, yeah, it would be nursing major. The pre-nursing major is more so right when you're leaving high school and you're applying to colleges. That's when you're pre-nursing. If you're a transfer student coming from a local community college or another university, you will be a nursing major there. But just make sure that the requirements, you have to have at least 60 units, I believe, in order to be eligible to be a transfer student.
Yeah, Cal State Long Beach is the same as well. I think I only know one school that you would have to apply as pre-nursing first, and that would be Cal State San Bernardino. But you just have to look at their website for that one. Yeah, Cal State Long Beach nursing major.
Next question. This is not for a specific school, but do nursing schools accept AP scores of 3 out of 5?
Yes.
Yes.
Mhm.
Yeah, I
Yes,
believe
they do.
three is the passing.
Mhm. They accepted my all of my AP scores, so
This question specifically for Cal State LA. Does Cal State LA require an interview as part of the application review process?
No, there's no interview. So I feel like that's definitely like relieves a lot of stress for a lot of students applying. The only requirements are just your grades. So that minimum GPA of a 3.25. You need the T score, which is the minimum of 70% in each category. And then just those prerequisites that are completed with at least a B or better. So those are the only things that are required. I will also recommend making sure that you get a great deal of amount of volunteer hours as well.
Another question for Cal State LA, is there a grade requirement for the nursing program classes, as in you have to maintain an A or B to stay in the nursing program?
You have to maintain at least a C every single semester once you're in the actual nursing program. But our professors, they're very, very understanding. We have really great professors. So, if anything crazy happens, like I know, especially, hopefully no one on this call was affected by the fires, but I know personally a lot of my classmates were affected by it. And with this new semester coming up, like our professors are really willing to make accommodations to allow the students to like, ideally succeed. So, you failing out or anything, don't worry about that. The professors are super understanding and they will work with you.
Mhm. Yeah, and the same applies to Cal State Fullerton's nursing program as well. We do require to have at minimum a 75% or a C for our nursing classes as well, in order for you to continue in the course. You do have the option to, you can have one failed class. If you get below a C, you have that one failed class, but you do have to stay an extra semester and move into the longer program. This question is for Cal State Fullerton. Does Cal State Fullerton's upper division transfer program require the TEAS exam?
We do not. So, um, we just do the Cal State Apply application. I believe there's a supplemental essay in there as well, and then the interview if you get invited to interview. We also have like a point system. I can link our website into the chat if you guys want to take a look at that. But we do the total possible points that we have is 100 to 105, and then it depends on different criteria. So if you have proficiency in a second language, that's 10 points that you can get for that. If you have any work or volunteer experience, that's 10 possible points for that. So I'll go ahead and link that in the chat. But no, to answer your question, we do not require the TEAS exam.
I have a question. Sorry, before we move on to another one. For prerequisites, do you take high school credit like chemistry? No, the only reason why we will take that credit is if you took an AP course in high school. So if that AP course, if you score a 3 or a higher, then we can take that for the prerequisites. But you just taking chemistry, say like in 10th or 11th grade, that will not be accepted.
Okay. Next question is, what have been the recent acceptance rates for Cal State Long Beach, Cal State Fullerton, and CSULA nursing schools? Do community college students have an advantage over CSU students based on the acceptance rates?
For Cal State Long Beach, for the past cohorts, we have been admitting 80 people, and I'm not exactly sure what the number is for the amount of applicants we have, but yeah, we usually do 80 people, and then 50 of those people will be going to the trimester route, which is the one with the summer classes, and 30 of those are in the semester route. So with advantage over CSU students, no, it's equal playing. Everybody there, just because you're a Cal State Long Beach nursing pre-nursing student, it doesn't give you more of an advantage for a community college student. So everyone, it's equal playing field. It's pretty fair. So.
For CalSTLA, every year it depends on how many applicants that we get. Our cohorts are usually around the number of 75. I know the last year there were about 700 applicants who applied. The year when I applied, there were over 1,000. So it depends on how many students are applying every year, but our numbers are typically for the traditional route, about 75 people. I know, see, I don't know personally too much about the ADN to the BSN route, but I do know for our school at least, there's like a partnership with a lot of you can look on our website too, but there's partnerships with a lot of like the neighboring community colleges next to Cal State LA too. And if you go through that route at your community college, they'll be able to help you like boost up your application, let you know what you need so that the playing field is equal as well. But yeah, we accept pre-nursing students who are already admitted to Cal State LA. Pre-nursing students, we have transfer students, those doing the ADN to the BSN route. So everyone, but yeah, like Mackenzie was saying for her school too, it's an equal playing field. You just have to, increase your chances of getting in. So making yourself as competitive as you can.
I will say for transfer students for CSUF, it is pretty competitive. Our cohort for the traditional BSN program is about 40 students. And depending on how many people move on within each cohort, depending on how many spots are open, those are the spots that are available for transfer students. So, for example, when I applied, there were only 4 available spots in the traditional cohort I was transferring into. And so that means there were only 4 transfer spots for transfers that we're applying in. So it is pretty competitive. Um, I don't know about the traditional BSN, Krista. I don't know how competitive that was acceptance rate wise, but for transfer students, I will say it was pretty competitive. But there's no advantage between the community college and CSU students. It's pretty even playing field as well.
Yeah, so for my year in general, I was told that around 3,000 students applied for a nursing program during my year, and gave offers to around 100 students in order to yield that 40. So that was the acceptance rate for my year. We don't accept internal transfers for our nursing program. So if you're already a Cal State Fullerton student and you want to transfer into our nursing program within your second year and you already finished the prereqs, you can't transfer until you have graduated with a bachelor's and you can apply to our accelerated program. So that's a primary difference between our program. We closed the internal transfer program to open up the upper division transfer program for our school. So there is really no advantage, but it is an even playing field as well for Cal State Fuller for Cal State students and for transfer students. Um, um, does Cal State Fullerton accept spring transfers?
We do not. It's
No.
fall admission.
Yes, only for fall. Um, at Cal State Fullerton, not sure if that question meant, do you accept transfer students from LA County nursing program?
Mm,
Um,
I'm not sure on that one.
um, I'm not too sure about this question specifically. If you mean that you're already in a nursing program that is in LA County, um, I'm not too sure about that question. What resources would you guys recommend for studying for T's and how long did you guys study for?
Let me go ahead and find the link to the book that I used. It's called Mometrics. I got it for like $30 off of Amazon. I'm looking over here to see if I still have it. I gave it away. But it I like it because it goes but over like different lesson plans. It gives you a whole bunch of practice questions. And then at the very end of the book, it gave you three full-length questions, like practice questions to help prepare. I also just searched up like on Google, T's practice exams, and then I think the version out now is either version 7 or 6. Make sure whatever you're studying is the correct version for the time that ATI is testing. But ATI is the platform. I know they also do offer practice exams on their website as well. It is a little bit pricey. My situation was a little bit different. I took a while to study for the exam because I thought I was going to apply one year and then my grades were fine, but my T's wasn't that good. I didn't get a lot of volunteer hours, so I took an extra year to apply. But I know many people, they can study for a couple months and they're pretty good. I think as long as you're just disciplined with it, you'll do well. But let me find the link for it and I will drop it in the chat.
Back when Cal State Long Beach was still doing the T's, I joined a Facebook group for like T's version 7, I believe. And it's like a supportive group of people who already taken the T's or who are studying for the T's, and then they kind of give information how the test was like and what to study for. And I highly recommend that. Okay.
Okay.
Next.
Um, Next question. For Cal State LA, what does A2 mean for prereqs such as anatomy and chem?
A2, sorry, say it one more time.
What does A2 mean for prereqs such as anatomy and chem?
Oh, so it's so when you're looking at the GE requirements for any Cal State school, um which one? Let me look it up. But the A1, A2, A3, it's all like the Englishes. So one, you have oral communication, you have critical thinking, you have argumentative writing. So whatever that one directly falls under. It's all of like the Englishes that you need to take. That's not a requirement for just Cal State LA. It's for all Cal States. It's part of the GE requirements, all the units that you need to take for it.
Thank you. Okay. Do you have any programs for an LVN to BSN program within Cal State LA or CSUF?
Yeah, for CalCLA, it will still be the traditional, but there are instructions to email our chair of the nursing department. Go ahead and go on our website. You'll email that person. I think right now in the website it says Stacy Warner. Just go ahead and send her an email. Let her know your situation, that you're going to be LVN to BSN, but it will still be the same route. The same route. It'll be traditional.
For CSUF, we don't have a specific LVN to BSN program, but you can apply to the transfer, upper division transfer, or accelerated program.
Okay. Next question. For CSULA, how would you describe the dynamic of your cohort? Is it highly competitive? How much do you guys support each other?
So with my cohort, we're one of the biggest cohorts from the last couple years. We started out with 75. I think now after what it was 3 years, we have about 68, 69. Um, I think the opportunity to like develop the bonds and everything. Like for instance, my friend group, we it really developed in like our clinical settings. So in clinical, it's a very small group, and with a lot of the times within like your first couple of years, you're with the same group for every hospital. So, you're at the hospital for 12 hours, you're in post-conference, so you're able to build those connections and, eat lunch with whoever. Nursing school it can be very stressful, so definitely having that support system to lean on. When it comes to our lectures, all 70 of us are in one lecture class. So I feel like it depends on you. Like when it talks about like the support and everything within SNA, it's all the cohorts mixed together. So it's all the three classes combined with accelerated BSN program, and then also with also, sorry, the pre-nursing students as well. So all of us get a chance like to mingle together and to attend events together and conferences together. But with your own cohort, I would say like it's up to you to make those connections and really go to study groups with people and everything.
Okay. Um, for Cal State Long Beach, what extracurriculars can help supplement our application if we do not have experience as a CNA?
If you don't have any experience as a CNA, I would highly recommend in considering volunteering, such as like what Zaria mentioned. She was was it the American? Sorry, what was your volunteering thing? Red Cross. The Red Cross. Are you a caregiver for your uncle or your or grandma or grandpa who lives with you? Are you someone that are you a pre-nursing student at Cal State Long Beach and are you in our CNSA program? It's this experience, it's really new and so I'm not exactly sure like what they account for since it wasn't required when I was applying, but I highly recommend seeking out volunteer experience in that are kind of like medical related.
This is for anyone. This is a general Cal State question, but for our CSU Apply application, if it gets denied for a nursing major, would we not be able to apply to the nursing school? Yes.
Mhm.
I have a couple direct questions. Sorry, it's right before this. Someone said I applied to Cal CLA for CSU Apply, but did not finish the supplemental application portion. Do I still have another chance to apply? So, no, unfortunately not. They actually did extend the application another week. It was originally due, I believe, the 7th. It was the first Friday of January. They extended it to the 15th. So, unfortunately, that deadline is passed. If you did want to apply, it will be for next fall. I have another one. If I dropped a chemistry class with a W and retook it and passed, will I still be able to apply to Cal CLA? Look at the requirements on the website. I know in the past we weren't able to accept any W's. I don't know if that changed now. Really, they've been emphasizing just the B minus part. Look on the website and then you can also email Jennifer Romero too. Her email is on the website as well.
Mm. This is for any Cal State, but what number of volunteer slash work hours is considered competitive?
For our school, if you are going to submit volunteer or work experience, it does need to be at least a minimum of 50. But I would say what's competitive, just thinking of all the applicants who did get accepted, everyone did have around like 150 to like 200. So I would say that's around competitive. But my tip for anyone who's applying to nursing school, if you are lacking in one area, I always say build it up in another. So, for instance, with me, I lacked a lot in my T score. It was not competitive. And so I made sure that my GPA was competitive and my volunteer hours. So just keep that in mind too. If you're lacking in one area, you can definitely help build yourself up in another area. And one of the easiest ways, I think, is getting that extra experience too. And also know for our school, work experience trumps volunteer experience. So if you and another applicant are hand in hand, you guys are very, very similar in your applications, and you have 100 hours as a CNA, someone else has 100 hours volunteer experience, like at Red Cross or whatever, that CNA is most likely going to get that admission because work experience does trump volunteer. So just keep that in mind. But if you're able to get both, then that's amazing as well.
For Cal State Fullerton, we consider either work experience or volunteer experience, not both. So it's either one or the other. Um, and going back to that point system, the points depends on the number of hours that you had as either a volunteer or for work. So for example, I'm looking at the website right now. So that same link that I had put in the chat, 1 to 60 hours is equivalent to 2 points, and then 200 or more hours is equivalent to 10 points. So it depends on how many hours you have. That's how much you have to look at what the equivalence is to the points.
Okay. Next question is for Cal State Fullerton. If I was denied for Cal State Fullerton for pre-nursing, could I still apply for Cal State Fullerton's nursing program?
I think that depends on whether you're applying straight out of high school or if you're applying as a transfer student. Because if you're applying as a transfer student, you should be applying into the nursing major, not pre-nursing. If you're applying out of high school, then you'll be applying to the pre-nursing program. So I'm not sure. I think it depends on where you're applying out of.
For each school, how many students were admitted in your cohort?
I think we touched upon this earlier, but just a recap, Long Beach from the past cohorts, it's been 80 people.
With calculate, like 75.
For Fullerton, it's 40.
Does Cal State Fullerton accept grades from a prerequisite class that was retaken?
I believe we do. Let me get back to you on that. I'll look at the website. I don't remember from when I applied.
See, maybe we can answer a few more questions and then we can close off. Let me see. Um,
So for the repeat, really quick, sorry, Krista.
mhm.
From our website, we only allow one repeat. So between your A and P microbio, if you didn't meet that grade requirement in the first attempt, we do allow one repeat. Um, but there's no repeat rule for the non-science prerequisites.
Thank you. Um, to answer, yes. Someone asked if our cohorts once a year for Cal State Fullerton. Yes, they are once a year. Um, Let me see. Maybe we can answer two more questions. Um, Here. For Cal State LA, is 90 in three sections and a 73 in one section still considered competitive or not for the TEAS exam?
Yeah, that's competitive. Just make sure within the overall competitive, I would say if you're 80 and above your total score, that's considered competitive. But just make sure within each of the sub four categories, it needs to be at least a 70%. So yeah, just keep that in mind.
Um, let's see here. Someone asked, how do you recommend students to track volunteer hours during college? How do all the Cal State Unified CSU school nursing validate your volunteer hours?
So with our school, and I will say when I was applying to other schools as a transfer too, it was very similar. They require, so like on a letterhead from your employer or your volunteering site, it needs to have like for instance, Zaria Greer volunteered at American Red Cross for a total of 300 hours as a blood donor ambassador following the performing the following duties. And it listed exactly what I did and make sure that it's signed with your employer or your boss's supervisor's signature. That's what they use to verify. And I will say when I was looking at other Cal States to apply as well, it was a very similar process too.
Yeah, Cal State Fullerton is the same. I'll go ahead and link an example in the chat so you guys can take a look at that.
Okay, let's see here. I think we'll take one more question. For working experience, I currently only had a medical assistant experience and it's over 100 hours. Would you guys recommend my volunteer hours or my medical assistant work hours? I heard that clinic jobs are not recommended to apply for nursing because it might be a disadvantage.
I don't think it's a disadvantage. I think I would choose the MA. Um, I mean, are you volunteer? It depends like where you're volunteering, I guess. But MA is still like a healthcare like job experience that, you know, um that it can be very useful. But I don't think that's a it's not a disadvantage.
Yeah, it's not a disadvantage. And for Cal State Fullerton, we only allow clinic like jobs, like you have to be in direct patient care, whether it's work experience or volunteer experience. And for Cal State Fullerton, for example, I'd take a look at the website. It depends on how many like specific hours you had as a volunteer. So, for example, if you're an MA, that's equivalent to 7 points. But it depends on how many hours you had as a volunteer. Because, for example, 61 to 130 hours as a volunteer is equivalent to 4 points. So you might just want to take a look at the website and see which one you would choose. Because again, Fullerton is either work experience or volunteer. It's not both, if that makes sense.
Okay, I think that is our final question.
I know you guys have like a lot of questions. Again, save them if you're coming to any of our open house. Save those questions and ask us in person. We would love to answer them. Also shoot us an email on our or a DM on Instagram, and we'll be able to answer those as well. Um, we know how hard this is, and we want to motivate you that you can do it. And that this is if this is something you want to do, then you are more than capable of getting into nursing school, whether it be at our schools or somewhere else. So we wish you guys the best of luck, and we appreciate taking in the time to just listen to us and be with us. And yeah,
Thank you guys.
Thanks for coming.
Thank you.
you can stop the recording. Sorry.